All right, listen. Being happy 1 minute and sad the other is usually bipolar disorder. Let's get that out of the window. That is one of the biggest misconceptions. I am Dr. Alleyne. I'm a psychiatrist. This is bipolar disorder. Imagine a person who suddenly feels unstoppable. They're sleeping less, full of energy, full of ideas, full of confidence, taking on projects, spending money. First, it doesn't seem like a problem. In fact, it could feel amazing. But then something starts to change. The decisions start to become more risky. The confidence starts to become unrealistic. The relationships start to shrink. Their job starts to become affected. They are just not functioning the way they used to. And eventually, after some days, weeks, or even months, if the person is not treated, they will crash and fall into a depression. Not just sadness, this is exhaustion, feelings of hopelessness, difficulty functioning, loss of interest in life. And this is why it's important to know what bipolar disorder is. It is not simply moodiness. It is a condition involving periods of depression, as well as periods of elevated or very irritable moods that we call mania or hypomania. These episodes could last sometimes days, sometimes weeks, sometimes even more. And they affect far more than emotions. This is sleep, energy, money, libido, work, relationships, all of it gets touched. Even your judgment becomes impaired. The challenge is that a lot of people tend to seek help during low times, like depression, but not necessarily the high, because sometimes that doesn't feel like an illness. It usually takes people outside of the person to notice when the slip is happening, to take them in for care. The good news is that bipolar disorder is highly treatable for most people. Honestly, once a person is assessed and diagnosed and treatment is started, you may never know that this is something that they're going through. If you've ever wondered if your mood changes are a bit more severe than your regular moodiness, definitely get assessed, see what could be causing it. Because understanding what is happening is one step to getting better. Or if you know someone who you think this might apply to, encourage them to get the assessment and to start treatment. It could make a world of difference.